There's been real growth in analytics. You hear in healthcare, incredible growth, lots of interest in analytics over the last, probably more so in the 5 years and maybe even the last decade, probably last 3 to 5 years. The problem is there's a lot of that going on. So what's happening, if you think broadly about predictive analytics, so at a population or individual level, there's a lot of that being developed, a lot less being used in practice. That's what oftentimes happens, especially in research or tech companies, is I think you have some ideas of what is needed. You create the solution without thinking about the workflow, the needs of the clinicians, the needs of the patients, needs of the staff, all of a sudden, but you're like, this is a beautiful product. But if it doesn't fit the workflow, doesn't fit the needs, then it becomes problematic. So the whole idea is for the research to be readily implementable in practice and for practice to bring ideas that they need more research on. Not only do you provide those analytics, but what do you do with it? Right? So sometimes you can say the risk of person X to have an event Y is 21%. What do you do with that 21%? And that becomes challenging. We're actually going through an example right now is colleagues in Winnipeg have developed this risk equation to be able to predict the risk of patients progressing to kidney failure. And this risk equation, it's really well known, predictive analytics, it's sort of real world, and has been validated in all sorts of countries, not just places. But we're taking a very sort of, I don't know if you want to call it a learning health system approach to sort of say, okay, we have this information. We're now talking to a number of clinicians to say, how would you use this information? We're talking to patients to say, if you had this information, how would it have helped you? These are oftentimes patients that already have kidney failure. Would this have helped you? If so, what would you have done? We're also looking at interventions around this to say, given a certain risk, are there interventions to decrease the risk of patients? So, we could easily have taken this and just put it in our electronic medical record, provided it to clinicians and say, go. No one would have probably used it. So right now we are taking a very deliberate approach as an example to sort of take this analytics that have been developed to say, how do we actually deploy it in a meaningful way that helps both clinicians and patients?